Hi everybody, welcome to another installment of Lunch with Helena. We are doing this, as you may or may not know, if this is the first time you're tuning in. I'm doing this to make sure that I can stay engaged with folks. We're all trying to figure out what that means in this time. We're also self-isolating, and so, of course, I'm a talker, so I really want to talk to my friends, and this is one way of connecting with them. And, I'm used to going to a lot of events and meetings, and those things aren't happening anymore. So here we are. Wanting to make sure that I keep learning about issues that I want to work on once I'm elected as state representative, and wanting to hear what's important to everybody. My website, in case you don't know, is helenawebformo.com. If you have questions for me or something you want to know more about that I can do a little research on and get back to you, or if you want to hear about what we're doing and how you can help our campaign, please do.
Make sure that I can stay engaged, Representative.
Oh, LaDonna, you want to turn your volume all the way down.
I know right now. Sorry.
And I just wanted to tell everybody, we did a virtual house party, and we had a really fun, complicated setup where we had slides and guests and virtual trivia, and it was awesome. But for these daily lunches, we're a little bit less formal, and we're trying a different setup. We are going to have a guest here today. I have LaDonna Appelbaum. She is the state representative. And her dogs, which are getting excited, I think, by listening to this. They were totally quiet. Yeah, sure. I'm going to mute LaDonna, and I'll continue. I'll continue what I was doing. So we're working on developing and improving our digital technology, but we're getting started with what we've got, and that's going to be interesting to see how that develops. So again, please do engage with me. Email me. Let me know what you want to hear about. Let me know what you want to work on. Yeah.
The mailman showed up, so Charlotte had
lots of things going on at LaDonna's house.
She was saving and protecting the house.
Okay. So I did bring LaDonna here because LaDonna is a state representative for the 71st District, which is sort of the Creve Coeur, Maryland Heights area. Is that right, LaDonna? Hi, LaDonna. No, stay where you are. Hi.
Okay.
How are you? Nice to see you.
Nice to see you. Sorry about all that. My very protective dogs was concerned about the mailman that was outside.
So that's great. No, it's good to have you. And LaDonna is the state representative, again, for the 71st District. What area does that cover, LaDonna?
It is in the, I would consider Maryland Heights, Westport, a little bit of Chesterfield, Creve Coeur, Overland, and all of that, and a big portion unincorporated.
Great. And we're going to talk about some legislation that LaDonna was working on for suicide prevention. But before that, I just wanted her to give us a little update on what's going on or not going on right now in Jefferson City. So, LaDonna, what are you up to these days? Are you guys home? Are you in Jeff City? What are you doing?
Well, we've been home for the past 2 weeks. The first week was actually the start of our spring break, which, worked out well with the situation. But then after that, we have been told to stay at home and not to go into the building. They are sanitizing the Capitol, which is good because we did have a member that tested positive for the virus. So he's out of the hospital and he's doing well.
Good.
But they want to make sure the building is clean because we do have to go back on Wednesday.
Okay. All right. And what are you all going to be doing once you go back? Do you know what you're going to be working on, or is it sort of business as usual?
No, it's not business as usual. This is specifically, we're going back to vote on a supplemental budget. This is something that we tried to do before we left 2 weeks ago. However, my friends on the other side of the aisle didn't think it was necessary at that time to vote on the amendments that we offered to get those passed. So now we have to go back and do it.
Okay.
And that was our big concern when we were leaving. We didn't want to come back until this
right.
happened.
Right. So I'm just going to interject and let everybody know. I know that I've been talking about this before, but for anybody who doesn't know, on March 18th, right before they broke for spring break, the Missouri House of Representatives had an amendment brought to the floor by a Democrat to provide the governor authority to use $87 million immediately toward hospital beds, ventilators, and towards PPE for our nurses and doctors. And the governor, from what I understand, did not do anything to help that be a priority. And the GOP members, LaDonna's being very polite, but she's a Democrat. The other side of the aisle is the Republicans. They felt that doing nothing was the correct thing to do that day. Of course, I disagree. A lot of my friends and neighbors work in the hospitals here and are healthcare providers. We have elderly parents, and I thought that was a poor showing of leadership. In fact, none. But anyway, I'm going to let it go back to LaDonna. So, LaDonna, you're going to be heading back specifically to sort of revote on that same issue, that same bill, or do you think there'll be more included now?
I'm not sure what's going to look like. The Senate is going to work on the first part, and then we, as the caucus, will discuss it, and then we will vote on it on Wednesday, I believe, at 1:00. There may be some. From what I understand, we're not all going to be on the House floor. We're going to be in our offices, listening to it and watching it from our desks. They will allow members to come to the floor to discuss anything that we want to discuss, but we have to get pre-approval, from what I'm understanding.
Okay.
And I basically would, if I wanted to get up on the floor and speak, I would go to Crystal Quaid, our minority leader, and say, Crystal, I have something I really want to discuss.
Okay.
And I'm sure she would be like, yes, LaDonna, we'll let you do this. You have 2 minutes
right.
To do this. And then when it's time to vote, they're going to have us come to the floor by district number. So there'll be one member coming in at a time to vote. And I have no idea how long that's going to take.
Right.
Get us all up there to vote and only have 10 people on the floor at the same time.
All right. Well, I'm glad they are taking measures to protect you, even as we are not asking anybody statewide to protect other people throughout the state, and we're doing that county by county, it looks like. Okay, let's talk about your suicide prevention bill and let us know what it's about and how far along it got in the process.
Okay. So my House Bill 1470, it's a suicide prevention bill, just like you said. This bill is specifically designed to give teachers in public schools a tool. And it's an online course that they take. It's free. It's 2 hours, and it can be broken up into different segments. So you don't have to sit at a desk for 2 hours solid, which right now we have those 2 hours, but in a traditional normal school year, teachers may not have 2 hours to sit down. So there's a course where you can take 30 minutes at a time, 15 minutes at a time, 20 minutes at a time. And it's, I took the course I guess it's been a month or so ago. And it's easy to take. And basically what it does is it helps teachers and administrators recognize signs of suicide. Teachers and administrators, they see these kids every single day. Currently not right now, but in a traditional school year, yes. And teachers are going to see and recognize personality changes. And it's not going to make them a suicide prevention specialist by any means or a counselor, but if we can do anything at all to recognize if someone is depressed or they're being bullied or whatever is going on, and that teacher can go to a principal or a counselor in a school and say, this is what I'm seeing, what should we do next?
Mm-hmm. That's great. I think that's really important, and I think for anybody who doesn't realize, the suicide rate for teenagers has skyrocketed in the last 5 to 10 years, and some people associate that with the increase of technology in their lives. I don't know that that's the case. I don't know that. The dynamics of our society have been changing quite rapidly in many areas for the past decade, I would say, and technology is a big part of why things are changing so quickly. So it's good that we have a tool that we can use, and I really appreciate that you brought that to the floor, and so to your committee. I'm sorry. And so, how far did the legislation get?
Well, it passed out of the committee with unanimous vote, and then it passed out of the Rules Committee with unanimous vote as well. So next is getting it to the floor, and I have to say that I am lucky, because I did have excuse me, I'm starting to get a frog in my throat. Thank you for reminding me to get the water.
Tricks of the trade.
Yes. So there is a Republican, I guess we could consider her a co-sponsor. She has a similar bill, a very similar bill, and so we brought our bills together. And me being a freshman and being a Democrat, it would be very hard for me to get any legislation passed without a Republican helping me. So I'm thankful that Representative Ann Kelly was able to partner up with me on that. I really, really appreciate it.
And I would like to add to this. This is a theme I hear a lot from legislators currently in office, and even senior legislators like Jill Shoup. Because the Democrats are in such a super minority, and they really have no leverage at all at the committee level or on the floor, from what I understand in general terms. I'll just say it that way. But what they do often is partner with a like-minded Republican on an issue that's important to both of them, and they partner. And so that's why we have a lot of co-sponsorships of really good legislation. So I want to say that, there's a lot of division and a lot of animosity between voters and between legislators. It's true, but I think that there's also a lot of examples of people coming together, crossing that divide for the good of the state and for the good of the people. And I want to see more of that. I mean, I think that's what we need. I know that that's not always, that doesn't always happen. I think that we need a little bit more goodwill in Jefferson City, but I am really happy to hear that a lot of these amendments and bills that go through are a lot of times Democrats may or may not get credit for it, but they're working across the aisle, and that's what we need to do. So I think that's great. And so
there was a few. I can't remember the bill numbers at this moment, but there were a few bills that that everyone voted yes on. The whole board was green, and that happened, I think, 2 or 3 times in the last week that we were there. And
that's great.
Every time that happened, we would all, we'd all clap and like, yay! It was like, okay, we all agree on something. Wow.
Yeah, well, but it's good because we don't really only hear about the places we disagree, right? We really only hear about what people are arguing about or what's going to make a good soundbite on the news or a good headline for an article. We don't get to hear about the things that really are helping us to do what we can along the way within the current system to improve things for folks. So I guess next I'm going to try to be on the same screen with you. Hi. So I guess next it's going to go, if you guys come back, it would go to the Senate, but it sounds like you guys might not come back unless maybe a special session or something in the summer to make up for this once things have settled down.
You know, honestly, I'm trying to learn this as quickly as possible, but I have not heard if we are going to come back after Wednesday.
Okay.
I have not heard that we will have session. I hope we do, because there's a lot of things that we need to get done, but I don't have not heard anything from leadership yet.
Okay. And in the meantime, if you know somebody who's feeling depressed about what's going on, or is a teenager who's not dealing well with being isolated at home, and is you're seeing signs of depression, you may not be an expert at knowing it, but LaDonna provided for me this phone number, which is the suicide prevention hotline phone number. We're very low tech until we get our digital platform determined. We're picking one. So the hotline is 1-800-273-8255. And so, please spread the word. This is going to be a tough time for a lot of people. What I think is going to help people is that none of this is going to be about personal failure if people lose a job or, it's not personal failure. We're all in this together. It will be happening to a lot of people, and I hope that we can support each other. Things are going to get really rough. I don't think we really comprehend how hard things are going to get. And I think we just need to try to be there for each other, for our neighbors, protect our families, and try to make good decisions. There are a lot of people who are still not self-isolating. And I know it's hard, but I do. And my mother-in-law, for anybody who is interested, is getting out of rehab. She's was in the hospital starting on March 10th. And believe me, the hospital was the last place I wanted to be. She's getting out of rehab today. She's at home now, and I have to go get food for her. So I'll be out buying food for an elderly parent, and many of us have to do things like that to care for our loved ones. So please take care of yourselves, take care of your families, and please do let me know if there are any topics you guys want to hear about. And I want to just thank LaDonna for coming on.
It was so much fun to be here. I really enjoyed it, and I'll do it again.
Yeah, well, maybe we'll get an update after Wednesday's session vote, and then, I really hope that the governor and the Republican legislators decide to act in a decisive way. The delay of 3 weeks, which this will be at least 3 weeks, March 18th, delay of 3 weeks of authorizing money to be spent is lives. And I think we can't forget that. So please call your legislators, call the governor, tell them what you want to see out of the leadership we have in place right now. Thanks. Have a great day.